Hello, if you're watching this video, it's probably because you saw the recent posts on my Instagram showing before and after pictures about when I had rosacea, and now I don't really have it anymore, or not as much. I'll get into that in a minute. If you look on my first one or two videos of this YouTube channel, it's me trying to self-medicate my face. You know, I'm trying to find all of these scrubs and masks and moisturizing things to try to treat, you know, what was going wrong on my face. And that was before I got an official diagnosis. So at the time, I thought it was just acne or just really irritated skin. I wasn't really sure what it was or what to do with it. When I got my actual diagnosis from the dermatologist, he said it's adult acne combined with rosacea. You know, I was treating it like acne, and acne medicines irritate rosacea more because acne medicines tend to be very drying. They can be very astringent, and that makes rosacea get redder, more irritated. It makes it flare up more, and it's also really hard to treat acne with rosacea medicine because rosacea medicine can clog pores and irritate acne and make your acne worse and give you bigger pimples, because rosacea medicine usually has to be something like goopy and calming. So that's why things like the oatmeal mask or even just colloidal oatmeal seemed to help for a little bit, but it didn't really kill the bacteria that was, you know, still growing and making things worse. So I'm going to tell you everything that the dermatologist told me. Number one, stop using acne medicine, because that's what I was doing and it was making everything worse. I'm a compulsive, obsessive skin picker. Every time I see a little whitehead, I have to pop it. That's what kind of triggered the rosacea. Like my face right now it's not rosacea, but I'm starting to get little tiny whiteheads and like things that I want to pop. And if I were to do that right now and keep popping everything, it would turn into rosacea, guarantee it. In the shower, not too hot, not too cold. Extreme temperatures can make rosacea worse. My rosacea was popping out in like the late fall, early winter, so the really dry, cold winter air was making it bad, and of course I like really burning hot showers because I came from the depths of hell, and that of course made everything worse. So dermatologist told me in the shower to start using CeraVe. You can buy this in a pharmacy anywhere. He recommended that I use the green one, which is for dry, normal to dry skin. So I have dry skin, it's sensitive, it's fair. This is non-comedogenic, so it doesn't clog your pores. It cleanses your skin, but it also keeps it from drying out. So it does put moisture back in after cleaning everything. He said to do this like 2 or 3 times a day. Then he gave me these 2 topical creams that I think did the bulk of the job of treating the rosacea. And he said one of them is actually an antifungal cream. And he says, you're gonna think I'm crazy, I'm giving you a medicine for athlete's foot, but there's something in it that treats one without irritating the other. I forget if it was, it could treat the acne without irritating the rosacea or the other way around. So he gave me 2. He gave me ketoconazole cream. I might be pronouncing this wrong, 2%. And then he also gave me metronidazole, I don't know. I'll just hold it up for a second and you can write it down. And he said, you don't need a lot, just like the tiniest layer on your face. You can put one right on top of the other. It doesn't matter what you apply first. And he said, just not a lot. If somebody can see that you're wearing cream on your face, you put too much. Then he prescribed me a mild antibiotic, and this is going to segue into how I got rid of my Chalazion, which I've had for months. And the antibiotic he gave me was doxycycline. And it's funny that he prescribed me this because when I went to the optometrist, the eye doctor, he prescribed me doxycycline hyclate or heclate, I don't know. So they're both a form of doxycycline. This one is a lot stronger. This one is, I think it has iron and it's a delayed release, and it's 40 milligrams, and this is just the straight doxycycline hyclate or whatever, and it's 100 milligrams. So I was prescribed both of these around the same time, and I wasn't sure which one to take, and when you look up Chalazion's and how to treat them, you get a lot of the same search results that you would get as if you were looking up rosacea. So I think somehow the Chalazion and the rosacea go hand in hand, because when I started using these things for the rosacea and the acne, and they say don't put it near your eyes, but of course I put it right on where this little Chalazion was, it seemed to help. I first got my Chalazion in like the first week of October, and it took until maybe like January or February until it even started to shrink. It was like this big red ball for a while. Eye doctor did not want to surgically cut into it or remove it because it was so close to a tear duct. And the eye doctor, you know, gave me this stronger antibacterial or antibiotic. And he also gave me these eye drops to put on the eyeball. And then he gave me a neomycin and polymyxine or myxine, I don't know, sulfates, and I don't know, all sorts of terrible confusing words that are probably really not safe to be putting on your skin, but he prescribed it to me anyway. So this is like a goop, and it's almost like the consistency of like Vaseline, and I would like put it on the eyelid because I also have a Chalazion on my upper eyelid, and you can kind of see the bump through the skin, and it pushes my eyelid down a little bit, but because it's not a big red bump like the one down here was, it's not as noticeable, but I notice it. And then this could actually go in the eyeball too. He's like, put it around your eyelid, and then you can even squirt some like in your, you know, inside your eyelids. And none of this was really helping. It only seems like once I got the rosacea and acne medicine that I started seeing a difference in the Chalazion. The only downsides to these is that this in the pharmacy is pretty expensive. It's like $7 or $8 for a bar of soap. And then these, at the time I had better health insurance. I had Cigna, and Cigna picked up most of the cost for these medicines. I think I wound up paying like $10 or $15 or $5, somewhere around there per tube, but now I don't have that insurance anymore, so and I can't even go see that same doctor anymore, so I don't know. I just have a lot of leftovers, and I'm going to try to use them wisely, not overuse them, because as you can see, I'm starting to break out again, and this could very easily turn back into the same blown out rosacea that I had a couple of months ago. I you know, had the soap, and I was using the medicines, and everything cleared up, and then my little bar of soap shrunk into like a little nub. I stopped, you know, I didn't buy more. I thought, oh, okay, that's it, I'm done. I don't need to use the soap anymore. But once I ran out and I stopped using it, I noticed I was getting more little whiteheads. And I was still applying this stuff, both of these things, but it wasn't making that much of a difference, I think, because these are not cleansing. So, like, I wasn't using the right kind of soap to cleanse and get the dirt out. I was just putting this stuff on top of skin that never got cleaned the right way with this. And I have not been taking antibiotics. I don't like to rely on antibiotics. If I do, I take a lot of probiotics with them. So these are all the things that helped both my rosacea and also seemed to help my Chalazion. Whether or not that was the intended effect of these medicines, it seemed to help. Chalazions seem to somehow be correlated with rosacea. A lot of people that get Chalazions also have rosacea, and this is just something that popped up just randomly. I mean, I did sleep with makeup on, but I've never really been prone to styes or Chalazions before, and that seemed to lead into rosacea, and that's not something I've ever had. All throughout my teenage years, I never had acne, so it, you know, now I'm almost 30 and getting adult acne and rosacea, so I don't know, maybe that's just like what I get for skipping acne as a teenager. I was like this in October, and I remember trying to cover up with makeup. I had the big Chalazion, but my skin wasn't bad, and then it seemed like in December, my skin got very bad. And I probably kept putting it off, trying to like treat myself from, you know, January to February. And I think it was like February or March I finally said, maybe even earlier than that. I honestly don't know. All I know is that it does take some time. Chalazions take even more time than rosacea does. So this Chalazion I got in October, and it didn't even start really visibly going away until maybe February or March, and I can still feel it. I still feel the tiniest little bump under my eyelid, but you don't see it. And then up here, this one, if I pull the skin, you can see there's a bump, but it's not like red and it's not at the surface of the skin like a little cherry tomato like this one was. So it annoys me because I can see it push this eyelid down, but it's not as noticeable as having a tomato. The rosacea does take time. It took maybe like 2 or 3 weeks until I was like, oh wow, my skin is starting to look normal again. So again, these are the medicines, these are the creams. These you need to get as a prescription. One is an antifungal medicine. I think it's this one, but it still somehow helps. I think this is like the antifungal one that does not irritate rosacea or acne, and this one is more targeted towards the rosacea and the redness. So this they say to like apply to scaly skin, and this they say to apply to like the red skin. So they go together, you use them at the same time, one right on top of the other, not too much, and then wash every day with this. I literally just went out to the store to buy more of this because it seemed like once I stopped using this about a month or 2 ago is when I started getting this again. And I don't want to go through the whole thing of having like bright red rosacea face again. So good luck. Let me know how it goes.